Welcome to Connective Care Education.
Health checks individuals need. A range of health checks are in place to support the health and well-being of individuals. The NHS Health Check programme is available for all adults aged 40 to 74. It assesses risks and gives advice in relation to heart disease, stroke, kidney disease, diabetes and dementia, and is carried out every 5 years. Advice is given that supports lifestyle changes and looks at health and well-being with a preventative focus. Individuals with learning disabilities often have poorer physical and mental health than others. Because of this, annual health checks are in place for adults and young people over the age of 14 with learning disabilities. The health check includes a physical checkup including weight, heart rate, blood pressure and taking blood and urine samples. Discussion about health. Ask about things that are more common if there is a learning disability, such as epilepsy, constipation or problems swallowing. Discussion about medication. If there is a health problem such as asthma or diabetes, the GP or nurse will check how it's going. Check to see if there are any other health appointments such as physiotherapy or speech therapy. Check in family and or carers are getting the support they need. Help to make sure that things go well when children move to adult services at the age of 18. If a learning disability has a specific cause, additional tests may be completed if there is a risk. For example, those with Down syndrome, a thyroid check may be completed. Bowel cancer screening. This screening helps detect potential problems before there are symptoms. A fecal occult blood test is sent through the post and stool samples are analysed. Cervical screening. This screening detects abnormalities in a woman's cervix. All women aged 25 to 64 are eligible for free screening every 3 to 5 years. Cholesterol tests. A blood test that checks for cholesterol, which is a type of fat in the blood. High levels of cholesterol increase the risk of heart attack or stroke. If cholesterol is high, it can be reduced by exercise, losing weight, dietary change and medication. Blood pressure tests. A cuff is put around the upper arm and inflated to take blood pressure. High blood pressure increases the risk of heart disease, stroke and kidney disease. If blood pressure is high, lifestyle changes will be suggested alongside medication. Breast screening. Breast screening detects abnormalities at an early stage. Screening is offered to women aged 50 to 70. Dental health checks. Carried out according to individual needs every 6 months to 2 years. These check teeth, gums and tongue and helps to keep the mouth healthy. Advice will be given on dental health, diet, smoking and alcohol. Abdominal aortic aneurysm screening Wales. AAA screening is offered to men over 65. It checks whether the main artery supplying blood to the body shows any signs of swelling. A ruptured or split artery carries a high risk of dying, so finding an aneurysm early can save a life. Newborn hearing screening Wales. The newborn hearing test helps identify hearing problems in babies as soon as possible so that support can be given to the child and the parents. Newborn blood spot screening Wales. Newborn blood spot screening is part of a range of postnatal tests to check on a baby's health. It happens on the 5th day of a baby's life when a small blood sample is taken from the baby's heel and tested for diseases that may cause serious illness or even death if not treated early. Antenatal screening. These tests are offered to all pregnant women at different stages through their pregnancy to check that the baby is growing as expected and to identify any risk of certain syndromes such as Downs and Pattai syndrome. The full range of tests will be offered. It is up to the parents to decide which they want to have. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 2, Worksheet 12. Health promotion agencies. There are a wide range of agencies that aim to promote health in Wales. These agencies will focus upon different areas of health and can be government-run or voluntary organisations, such as charities. They include the National Health Service, NHS, Public Health Wales, which is part of NHS Wales, local authorities including schools, national and local voluntary charitable and voluntary organisations such as the Family Planning Association, British Heart Foundation and British Nutrition Foundation. NHS. The NHS covers the whole of the United Kingdom and has a major role in promoting the health of the population. The NHS provides diagnostic services and treatments for various health conditions. If an individual is diagnosed with a condition, appropriate advice and treatment would be offered in order to try and maintain the individual's health and well-being. The NHS also offers health promotion service, Public Health Wales, and advice to try and encourage people to make healthy choices and to prevent ill health. This can include advice and services about issues such as mental health and well-being, healthy eating, sexual health, alcohol and drugs, and oral health. Social prescribing by GP clusters. Social prescribing, sometimes referred to as community referral, is a means of enabling GPs, nurses and other primary care professionals to refer people to a range of local non-clinical services. Social prescribing schemes can involve a variety of activities which are typically provided by voluntary and community sector organisations. Examples include art activities, group learning, gardening, befriending, cookery, men's sheds as support for bereaved or redundant men to combat anxiety and depression. Local authorities. Councils have been given a leading role to reduce health inequalities and premature deaths and improve health and well-being. They are required to tackle the cause of ill health, reduce health inequalities and commission services that address the needs of the local population, particularly the health needs of the disadvantaged and vulnerable groups, as well as giving consideration to equality issues. Schools. Schools promote health by providing health education through both the formal curriculum during lesson times and through the informal curriculum, such as through assemblies. Through the formal curriculum, classroom-based topics that might include healthy eating, mental health and well-being, and sexual health. Through the informal curriculum, topics such as road safety may be addressed, for example, having an assembly on road safety or bullying prevention. Teachers and lecturers can encourage positive attitudes and healthy living and give advice on general well-being. They can carry out classroom activities to promote health, such as projects on diet and facilitate physical education. Public Health Wales believe that teaching and learning can help an individual build the knowledge and skills they need to grow into healthy individuals through knowledge, so underpinning, example, how the human body works, the NHS and other services, wider influences on health and well-being. Knowledge, topic or theme specific, so the effect of smoking on the body and nutrition. Skills: cross-cutting, assertiveness, conflict resolution, risk assessment and management. Skills: topic or theme specific, physical skills or practical food preparation. Charitable organisations. Charities work both on a local and national level. National charities extend their work across the whole of the United Kingdom. Health promotion charities raise awareness about health-related conditions and provide support and advice to those that are affected. National charities that promote health include British Heart Foundation Cymru, Dementia UK, Mind Cymru, Diabetes UK Cymru, Marie Curie and Mental Health Foundation Wales. Local charities work on a much smaller scale and generally focus their work within a town, city or county or country within the United Kingdom. Their funds tend to be more limited compared to a national charity. Charities that work on a local level within Wales include the WAMH in PC, which is Primary Mental Health Care and Services Wales, Gofal, Hafel, Latch, which is the Welsh Children's Cancer Charity, and Welsh Hearts. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 2, Worksheet 13. Information that supports health promotion. Health promotion materials. Many types of health promotion materials are used in everyday life. Health promotion materials include posters, leaflets, websites, television adverts and social media. They are designed to inform, motivate and support individuals to maintain and improve their health and well-being. Different types of materials are aimed at different target groups. A target group is who you aim your health promotion campaign at. The target group of health promotion materials can be almost anyone: children, adolescents, employees, men, women, the young, the old, and so on. Campaigns are much more effective if they are targeted at a specific group and tailored to meet that group's needs. Older people are less likely to use social media, so campaigns targeted at older people would have no use on social media, whereas adolescents use social media frequently. Therefore, this method would be more suited to this target group. Posters. Health promotion posters are used to inform people about health promotion topics such as vaccinations, road safety, health screening, etc. They may use shock tactics to get people's attention. They can be placed in places such as schools, GP surgeries and hospitals. Posters may provide limited information about the issues and where to go to get help. Leaflets. Healthcare leaflets aim to provide accurate, relevant, up-to-date health information and advice in a simple, accessible way. The leaflets encourage individuals to take greater responsibility for their own health and well-being by helping them to make informed choices. This in turn contributes to the reduction of health inequalities and ensures that healthcare services are not overburdened with patients asking for advice. As we live in an increasingly digital age, the need for information on demand, allowing individuals instant access to the advice they need to make active, informed choices about their own health and well-being. Individuals will search for healthcare advice from reputable sites that they trust to give them accurate information, such as NHS Wales campaigns, television adverts. Mass media campaigns are used to expose a large number of individuals to messages through routine uses of existing media such as televisions, radio, and newspapers. These campaigns are usually aimed at changing the behaviour of individuals and helping them to adopt a healthy lifestyle or recognise their own unhealthy choices. They also help to provide a link between rural communities and access to vital health information. Social media. Increasingly, public bodies are using social media channels such as Facebook, Twitter, YouTube, and Instagram to share information and engage with target audiences. Individuals are increasingly using peer-to-peer support via social media when diagnosed with a chronic condition or to seek advice if they are worried about their health or the health of others. They are also more likely to adopt a healthy lifestyle change and follow medical advice if they are receiving online support and encouragement from their peers.